So good evening once more. My name is Johnson, and I'll be moderating today's training session. So without much ado, we'll go straight ahead to introduction of our speaker for today, and then we begin the session. So you would permit me to share my screen. As soon as you can see my screen, please let me know. Thank you. Clinical Science Research Club with Abba Laraba Favor, Research Fellow, Intercountry Center for Oral Health for Africa. Abba Laraba Favor is a junior research fellow at the Intercountry Center for Oral Health for Africa in collaboration with the World Health Organization, Jos Plateau State, Nigeria. She specializes in oral health and public health research with a focus on leveraging artificial intelligence and machine innovative solutions for improving healthcare outcomes. Favor is a profound research methodology facilitator with a deep passion for applying data science and machine learning to address complex real-world challenges. She is currently working on her master's thesis titled Predictive Modeling for Early Detection of Oral Cancer Using Machine Learning, demonstrating her commitment to advancing impact research and fostering knowledge sharing initiatives. As Vice President of Krebs Cycle, Favor facilitates research training programs for resident doctors, students, and young professionals. She has enhanced her expertise through courses at the University of Washington's Global Health Department and AutoAid UK. Committed to mentorship and innovation, she empowers future researchers and data scientists, leveraging technology and knowledge to drive transformative change and create a lasting legacy in public health and data-driven problem solving. Ladies and gentlemen, I want to hand over the mic to our speaker today, in person of Abba Laraba Favor. Ma, the floor is yours. Welcome, ma.
Thank you very much, Titus. Thank you for that beautiful introduction. Good evening, everyone. Let me know if you can hear me.
Yes, I can hear you from my end.
Okay, I'll just go ahead to share my screen. By the end of this session, we should be able to explain the purpose and significance of research, of literature review. We should be able to demonstrate effective search techniques for retrieving literature, then organize literature using thematic, chronological, and methodological approach. We should understand how to analyze and synthesize findings to identify trends, research gaps, and key themes. And lastly, I'll be showing us how we can leverage artificial intelligence to do our literature review. So I'll urge you to stick with me to the end. Jot down your questions if you have any question. So a quick reminder, what exactly is research? So research is a systematic investigation that includes development, testing, and evaluation designed to discover and contribute to a generalizable body of knowledge. Now, for you to be able to discover and contribute to a generalizable body of knowledge, you have to identify a research gap. Now, how do you go about identifying a research gap? You have to do your literature review. You have to read articles around the subject matter. You have to understand what you want to do, go source for literatures and all that. So these are steps in carrying out research. This first step is to identify the problem. For you to be able to identify the problem, you have to read. You have to do extensive reading. Read about the topic, read about the subject area to be able to identify the problem. What are authors saying about that area? If I'm interested in oral cancer, what has been done about oral cancer? What are the gaps that have not yet been filled? What are the questions that have not yet been answered? And most of the time, when we do an extensive literature review, you discover that sometimes some of the things you are thinking about have already been done. Some of the things you're thinking about have already been done, and you see more ways to exploit and to even do it better. So literature review is important before you begin your research and even while you've started your research. There are two things that comes to mind when you talk about literature review. First of all, first thing that comes to mind is the task of reviewing articles, reviewing literature, sourcing and reading through existing literatures. Sourcing and reading through existing literatures. And the second thing is the actual chapter. That's where most people have challenges. The actual chapter that you have to write up in your dissertation, in your project, or your thesis. Mostly chapter 2. So you source literature, you read about your topic, and you have to write down what you've understood or what you've read about your topic. So literature review is an approach to evaluate and examine published information or literature on a particular topic or field. So what you do, you examine published information or literature or articles that have been published on a particular topic or field of interest. You go online, you search for these works, you get them, you read them, you evaluate them, and you examine them and write them down in your own words, in your own thoughts, which demonstrates that you've understood what you've learned, what you've read. So as an author uses the literature review to create the foundation and justification for his or her research work, or to demonstrate knowledge of the current state or field. So you use your literature review to create a justification. Why is your work worth doing? Is there a gap? Create a justification and a foundation for your topic. If I'm interested in oral health literacy, I need to create a foundation and justification to prove that the oral health literacy of the population is either low or high or something. Give yourself justification for why you want to do that particular topic. And that's one thing you get from doing a literature review, reviewing other people's work. Now, there are some things to note. So even when it appears that there is no literature around a particular research area, because it is new, you still have to show that you have consulted enough literature to prove this. You have to prove that you've read enough, you've consulted enough literature to prove your point that, okay, what I'm doing is novel, nobody has done anything around it. Even at that, if I'm interested in oral cancer and nobody has done anything about oral cancer, someone has definitely done something about breast cancer, cervical cancer, and all those things that I can, read about and put them down in my own chapter 2 to prove that I've read extensively, I've read enough articles, and I'm not trying to reinvent the wheel. I'm not trying to repeat what someone has done before, and I have enough justification for what I want to do. So even if your work is novel, you have to really prove it in your literature review. That's why in academics, you don't make assertive statements like there is nothing, there is no work. The most you can say is, based on my literature review search, I have not seen or have not found anything done in this particular field, because literatures and articles are coming out every day. There are lots of publications that people churn out every day. So you have to prove that you consulted enough literature and it has not been done. So the purpose of a literature review, one, is to demonstrate your knowledge of the topic, provide a background for the study. Like I've been saying, you demonstrate that you understand the topic of interest and provide a background. Introduce your readers to what you are talking about. Not everybody might be knowledgeable about the field you're writing about, so you introduce them to it, provide a background for your study, and also your literature review gives you a conceptual framework on how to go about your research from beginning to the end. So literature review reveals the research gap that you will find. For instance, I'm interested in working on the fluoride content of juices commonly consumed by children under 8 years old. And I've discovered that there are lots of literatures that have checked the fluoride content of water, fluoride content of carbonated drinks, but there's no literature that I've checked, or there's limited literature to Nigeria that have checked the fluoride content of juices that are commonly consumed by children 8 years and below. And why is this a concern? It's a concern because children 8 years and below are prone to fluorosis. That is when you can get fluorosis. Fluorosis is a white lacing marking on your teeth. So you need to review literature to create a research gap that you will fill, then lay a foundation for your conceptual framework, and also to inform your methodology. If I'm reading about oral health literacy or primary healthcare workers, then I have to prove that I have to look at the methodology. What approach have the authors used? Did they use a qualitative approach? Did they use a quantitative approach? Or what study design have they used to explore their own topic? And what am I going to employ to do mine? So literature review helps you with those information, even your sampling. How do I go about my sampling? How do I go about my dissertation, my methodology session, arranging everything, choosing the right approach to my research and all that. So literature review helps you, informs your methodology. The literature review should answer the following questions. If you are doing a literature review, you should be able to answer the following questions. What do we already know about the topic? What is already known about the topic? You need to say what's on ground, what has been done before, what's already known. How well have we, had researches on cancer? Have we had researches on diabetes, malaria? What is already known? What have been established from people's work about your topic? Then you have to also answer, has anyone else done something similar or related to what you propose? Now, for the fact that someone has done something similar to what you are proposing doesn't necessarily mean you will knock yours out. And the reason is that the population the person is using might be different from yours. The same work must have been done in China. If you have a justification for doing it in Nigeria, then it's fine. It can also be done. Maybe the reason is your justification could be the weather or the diets or something else. So has anyone done anything similar to or related to what you propose to do? Then where do you work? Where does your work fit in with what has already been done? Where do your work come in? How do I bring in my own work? Like the example about the fluoride content in juices. You can say your work comes in because children consumes a lot of juices. Children drink a lot of juices, refined juice and all that. Even fresh juice. Parents now make juice from fruits to give to their children. So children consume a lot of juices. So this is a justification for your own work. That's where your work fits in. Then you can say why, you can answer the question, why is your research worth doing in the light of what has already been done? That's your justification. Dr. Tayo will ask you, and so what? If you come with your topic, he's going to ask you, and so what? Now that's the justification. You need to provide a justification for your research, why you have to do your research. Then what you have to say critically about what is already known. Now this one is a little bit dicey. When writing your literature review session, you do not write your own opinion. You just read and write down critically what you've understood. I have an example here. The role of alcohol consumption as a risk factor for oral cancer has been a topic for considerable debate in literature. Christopher et al. 2002 argued that alcohol plays a significant role in the development of oral cancer, citing epidemiological studies that demonstrate a strong correlation between high alcohol intake and increased risk. Conversely, Priscilla et al. 2023 questions the strength of association. Now you can see that from something like this, my opinion is not here, but I'm writing down what I've understood from Christopher's work and Priscilla's work. I'm bringing them together into my own literature review section. So in your literature review section, you don't write down your opinion. You save your opinion for your discussion section. So there are different types of literature review, a whole lot of literature review. However, I'll just be talking about 3 types of literature review. First of all is the narrative literature review. This narrative literature review is the traditional one that we do in schools, be in the project, in our project, first degree project, master's thesis. This is what is common, narrative literature review. And the purpose of this literature review is to summarize and critique literature on a specific topic. For narrative literature review, you have a specific topic So you bring literatures together, articles together, published information together to summarize them, to give your own work a body, to write your chapter 2 and all that. And the scope of narrative literature review is broad and flexible. You can choose as many literature as you want. You can go far and wide to write down your literature review section. It's broad and it's flexible. And however, it may not cover the whole aspect of your topic. I might find a literature on oral cancer and not find a literature on machine learning or something talking about the two of them together, but it still works. The method you apply when writing a narrative literature review is the selection of articles is informal and lacks transparency. You can go about it any way you want. Just type in a Google search, add PDF, publications will come up and all that. It's informal. The way you source for articles to write a narrative literature review is informal. And the outcome at the end of the day in a narrative literature review is the overview of findings and keys. You just write the overview of findings and research gap that you've discovered while carrying out this literature review. So the common use is for exploratory research and theoretical framework, commonly used for exploratory research and theoretical framework. While for the systematic review, if you're someone that reads a lot of articles, I'm sure you must have seen this word before, this systematic review attached to some articles. Something like oral manifestation of HIV, full column, a systematic review. Now, the authors are trying to tell you that the kind of literature review they did for that work is a systematic review. Now, what does it do? For a systematic review, it is narrower. Your search or scope is narrower, and you are trying to answer a specific research question. So you bring works together, and when searching for articles in a systematic review, you follow a very rigorous and a strict pattern, meaning that you can only select articles maybe from only peer-reviewed journals or within a particular year, maybe from 2020 to 2024. And it answers a specific research question. And at the end of the day, the goal of a systematic review is to help us make clinical decisions and for policy formulation. And the reason is because a systematic review gathers information from different published articles, most of the time from peer-reviewed journals that have already been validated. So you can validate what the researchers have done and the results they have gotten. That's for systematic review. While for scoping literature, what you basically do here is used for a topic that is novel, a topic that has not yet been explored. You don't have a specific research question when you are doing a scoping literature review. Your research question is just open. You have broad questions and you cover a wide range of articles. You can gather articles from different subjects, different diseases, different things, just so that you can make sense of what you are trying to understand. So they use it most times for topics, research topics that are novel, that people do not have full knowledge or full understanding of. Like when COVID came out newly, you do scoping literature review for topics like that. And at the end of the day, you can use the scoping literature review for policy formulation also, because you discover new things and it usually informs new research. It gives your research direction and it ends with a specific research question. It gives your research direction and ends with a specific research question. However, most of what you will be doing for this stage is the narrative literature review. Now let's go to the main item for the day, how to conduct a literature review. First off is our problem formulation, data collection, data evaluation, analysis and interpretation, then public presentation. So I'll take them one after the other. For problem formulation, the first thing you want to do is, what do you need to find out? You need to write, what do you need to find out about your topic? And for you to be able to know what you need to find out, you need to, first of all, source articles and read. You need to source articles and read those articles. Then you will know exactly what you are looking for, or the problem you want to, come up with, or the research gap you want to fill. So what are the component issues? What are the component issues? Everybody's talking about artificial intelligence. How does it affect clinical decisions? How does it affect medicine, medical practice and all that? So these are component issues. What are the component issues in your topic that you want to find out? What are the component issues you want to discuss? So these are things that will lead you to your problem formulation. So recall research question. Your research question needs to be feasible, innovative, novel, specific also, and most times directional. I have an example of a research question here. What are the common post-treatment complications faced by breast cancer patients undergoing radiotherapy? This research question is direct. Now, this is how your problem come about from a question. From your question, after reading, you get a question you want to answer. Then you begin to put down your literature review, you write down your problem statements, then you go ahead into the research. So you need to have a clear cut of what your question is, or what your research question is. And you can only get that from reading articles that has been published. So the next thing you want to do is data collection. Data collection, you need to identify relevant literatures, and you have to identify them by sourcing data online. There are databases, there are journals, there are internet, Google search engines, scholars in field, conference proceedings, books, library, etc. that you can use for data. I have some examples of some relevant databases here. PubMed, I'm sure we are used to PubMed as medical students. PubMed, Cochrane, Web of Science, clinicaltrials.gov. For this clinicaltrials.gov, what you have here are just their registries and results database for clinical trials. If you're interested in clinical trials, it's something you might want to explore. Then Global Health. This one focuses on public health and global health topics. These are examples. There are a whole lot more. It's just for you to just type in databases related to your field online, and you get a lot of them. And some of them are free. PubMed is free, open access. Now, how do you search? How do you search? If I go to Google Chrome, and I just type in my topic directly, I might be restricted. There might be a lot of restriction. I'll not be able to get or maximize the search. I'll not be able to explore everything I want to do to get enough literature. So there are keywords that you should use when searching for something online. Now we have these Boolean operators. Now for Booleans, we have or. The or help you to what? To broaden your search. The and helps you to combine your search. The not helps you to narrow the search. So I'll have an example here. Consider this topic, the effectiveness of vaccines in preventing influenza among elderly adults. The effectiveness of vaccines in preventing influenzas among elderly adults in Plateau State. There's supposed to be a location there in Plateau State or Jos or wherever. So if I'm going to use all to search, I'll write something like this. The effectiveness of vaccines or vaccination or immunization. Now this broadens my search. Any publication that I've used vaccine, I will find it. Any publication that I've said vaccination, I'll find it. Any publication that I've used immunization, I'll find it. I've just used synonyms here. It broadens my search and do not limit my search. So if you search using this Boolean operator and synonyms of your keywords, there will be no reason for you to say, I've not seen anything done in that field. Except your search, you're limited by your search. And if you're going to use the and combines. So you'll be having something like the effectiveness of vaccines or vaccination or immunization and influenzas or flu. So if you don't call it influenza, you call it flu. Then the not actually helps you narrows your search, excludes. I have this example also. The effectiveness of vaccines or vaccination or immunization and influenza or flu, not children, because I'm referring to elderly adults, maybe 60 and above, not children. So it's going to take away articles that were written on children and give you on a different population. Yeah. So the next thing you want to do is you want to evaluate your data evaluation. And how do you do data evaluation of the articles you are using? First of all, what are the author's credentials? Who did this publication? Who did this job? Who wrote this article? Who did this research? Who are they? You want to know the author's credential. Most times on articles, you will see something like Christopher et al., University of Jos, Titus, University of Jos. So you know where they are from. You know where you can find them. Then how old is the source? 80% should be less than 5 years. Should be less than 5 years, except your research or except the article you are referring to is a gold standard article. There is no reason quoting an article from 1970 something or 1950 something, except it's gold standard. And even though it's gold standard, there's something that must have improved on it. So your article should not be more than 5 years, ideally. However, it depends on the institution, but ideally should not be more than 5 years. 80% of it should not be more than 5 years. Now, are the arguments supported by evidence? Is the research evidence-based? Did they carry out a clinical trial? Did they just do like a random sampling? Did they do systematic sampling? How did they come about their results? How did they do it? Was it a case control study? Was it a cross-sectional study? Was it a clinical trial? You want to answer these things because there are levels, there are hierarchies, there are levels of evidence. And the highest is a systematic review. I have a chart to show us that. Now, does the work contribute in any significant way in understanding your topic, or you just want to populate your literature review section? Does it contribute in any significant way to understand your topic? If I'm going to be writing about diabetes, what is my justification for bringing cell phone use articles or something really distant or not even related? Do you just want to populate your literature review section, or you really, really want to make sense of what you are doing? So you have to make sure you find works that contribute significantly to the topic. Now, your initial reading, when you get an article, your initial reading of the selected sources, what do you want to focus on? You want to focus on the main themes. What are they talking about? What are the theories in the article? And what are the arguments? What are the arguments? Because the interesting thing is the article you are reading has also read, the writer has also read other people's article. So you can read that person's literature review section. You will understand the existing arguments around that topic, the theories around it, the main themes, or the main theme that the person is also talking about. Then the main authorities in the topic also, the main authority in the topic. You cannot come and write, for example, you can't write or do a research around oral manifestation of HIV and you are not quoting Dr. Taiwo. He's an authority in that field. So there's something that happens. It just means that you've not fully explored your search. You've not fully explored what you are doing. So you need to identify the main authorities on that topic. Then the major ongoing debates in the literature. This is the same thing as the arguments, the major ongoing debates in the literature, like in the world of artificial intelligence in clinical decision making. Most medical doctors don't trust the artificial intelligence models. So these are things to look out for when writing your article or writing your work around leveraging artificial intelligence to clinical decision making. How do we make them trust the models that we have built? Then the research method commonly used to examine the topic. What method of research did they use? Are we talking about observational studies? Are we talking about experimental studies? Is it a qualitative approach or a quantitative approach? What kind of method did they use in their research? Then the significant unanswered questions in the topic area. So you want to look at the questions that have been unanswered, your own part you want to fill when you're evaluating data. Now, this is the hierarchy of evidence or the pyramid of evidence. So at the lowest point, you have case reports, opinion papers, and letters. This is the lowest. Then next thing is a cross-sectional. As we go ahead in these sessions, subsequent sections, you understand what a cross-sectional study means, because we're diving into study designs and we'll be explaining them one after the other. Followed by cross-sectional, then you have case control studies. This is a retrospective study or backward study. Or is it a cohort study? Cohort study is a follow-up study. However, in a cohort study, you do not do any intervention. Or is it a randomized control trial? Is it a randomized control trial? Or is it meta-analysis? Meta-analysis, you work, you bring the method of different articles together to create one article. Or is it a systematic review? Systematic review is at the top because systematic review brings articles that are answering one research question together, that these articles are already validated article published in peer-reviewed journal. So they bring it together to see if they are saying the same thing. So we can make policies out of them. We can make clinical decisions out of them. So that's the highest. That's why it's on top of the pyramid. Literature review gap. I've mentioned this quite a lot. Now, what's a literature review gap? So a research gap is a question or a problem that has not been answered. A question or a problem that has not been answered, or probably it is answered but not in your population or not with the method or approach you want to use. So that's a gap. So these are ways you can identify gaps. Christopher et al. Has answered the question, but he used a qualitative research approach. So now I'm going to use a quantitative research approach because I think I will get a better outcome. So research within your field and all that. Sometimes a research gap exists where there is a concept or new idea that hasn't been studied. There are most times. So the more you read, the more you're able to identify your research gap. So this is a table that shows us the different types of research gap that we have. We have evidence gap. I'll be sharing the slides with us so we can look at it in-depthly. Knowledge gap, practical knowledge gap, methodological gap, empirical gap, theoretical gap, and population gap. So now you might be wondering, what formats do I use, in conducting my literature review? There's usually no required formats for a literature review. There's no required format for a literature review. However, there are some basic things your literature review must contain. First of all is the introduction and conclusion. So your introduction provides a background, gives background information to your reader. If I'm going to do an article, I'm currently working on predictive modeling for early diagnosis of oral cancer using machine learning. If I'm writing my literature review session, I'll assume that the person on the other end doesn't know what machine learning is and doesn't know how these things can be used. So I need to ease my reader gently into understanding the concept of what I am talking about. So we provide background information, such as the references to the pioneers of the field and all that, the beginning, and offer an excellent closure. Your conclusion should be good, should be great. Offer closure at the end of the discussion by discussing the implication of further research to the field. Implication of further research to the field. So you want to ensure that in your literature review section, you have an introduction and also have a conclusion. And of course, you have a body. So you should avoid direct quotations. Avoid direct quotations. Plagiarism is a crime. So avoid quoting people directly. And if you must quote an author, please use the quotation mark, open quotes and close quotes. And there's something Dr. Tai will always say, the more quotations you have in your literature review session, it just proves that you do not understand what you read. Because why are you quoting the articles verbatim? If you have so many quotations in your literature review section, it just shows that you do not understand what you've read. If you understood what you've read, you'll be able to put them in your own words. You'll be able to put them in your own words. And this demonstrates your knowledge of the topic. So it's okay to use quotations, but you have to use open quotation, close quotation, and reduce if you can. Do not quote at all, just paraphrase. So put ideas into your own words will ensure that you are interpreting the found material for your reader so they can understand what you are talking about. Then you can organize by topic or theme rather than by author. I cannot say because Christopher is C and Titus is T, I must write whatever Christopher said first. No, it doesn't work that way. You should organize it by themes, patterns, ideas, topics, subtopics, headings, instead of by author or by year of publication. So you not end up creating a book report or a book series. So you don't end up creating a book report or a book series. So you arrange by identified themes and patterns. It's okay to use headings and subheadings. It will help. So guidelines for critical analysis. If you want to do a critical analysis, if you pick up an article and you want to, what do you look out for? What do you look out for in the introduction section, in the other sections in the article? So this is a guideline for what to look out for. In your introduction section, you want to identify the research problem. You want to identify the research problem. What research problem is that author trying to answer? And how is it significant to what is on ground? Now, evaluate the objectives and the aim. So look for clearly stated stated research goals and questions. So they have it in the article. You want to look at the person's research question. You want to look at the person's objective or the aim of the research. Then you want to review the literature summary, assess how well previous studies were synthesized and how the person identified their own literature gap. Then note key concepts or definitions. What's the person repeating? What are the key concepts that the person keeps talking about or definitions that the person have used or talked about? Then if you come to your method section, for your method section, you want to look at how the person did sampling. Is it a probability sampling or non-probability sampling? Even if it's probability sampling, wow, there are different types of probability sampling. Or is it multi-stage sampling? Then how did the person collect data? How did the person collect data? Was it through questionnaires? Was it through interviews? Was it even through pictures? Because now you can leverage collecting data through pictures. Was it through pictures? So how did the person collect data? Then consider the sample size, very important, and the demography. Consider the sample size. There are established ways of getting your sample size for your research. However, when reading other people's articles, you want to look at their sample size. And most times they write the reason why they are not meeting up to the sample size, that if there's any issue with the sample size. You want to see how they did their sampling to arrive at that sampling size, that sample size. And this is very important, especially when you're doing a work on like plateau states or secondary schools. You have to sample correctly so that every school have equal chance of entering into your research or your survey. Then you want to consider the variables and statistical analysis that the author have done or have used. What kind of variables are they? Did the author talk about any confounding variable? Did the author identify their independent variable or dependent variable? Don't be bothered about these variable names. We are going to demystify them as we go on in this session, this club sessions. What statistical analysis were used? Is it chi-square? Is it t-test? Is it ANOVA? Is it Kruskal-Wallis? What's their justification for using that? They want to also look at participants' inclusion and exclusion criteria. How did they use did they select the participants to enter their study? And how did they exclude participants from their study? So it's important to note that your inclusion and exclusion criteria should not be a mirror image when writing your own. You shouldn't write inclusion criteria, participants must be female. Exclusion criteria, all male participants are excluded. It's not, it doesn't sound, it's not correct. It shouldn't be mirror image of each other. You can say something like inclusion criteria, participants must be female. Exclusion criteria, participants must not be younger than 25 years. So we already know that participant must be female already excludes the male. Then your exclusion criteria is those females that in your study must not be younger than 25 years. So your results section, what do you want to look at in the article results section? You want to pay attention to keywords. You want to pay attention to words like increased, decreased, improved, reduced, no significant difference, no association, no change. So these are words, it tells you what the writers or the authors have discovered at the end of the day. So you want to pay attention to that to see if it's something you want to improve on, if it's something you still want to carry on. Then when it comes to the discussion section, you want to note the author's comments about the research. You want to, most times in the discussion section, the authors write about their limitation, the limitation of the research. So did it work? Did it not work, and why? So you want to look at these things. These are things to look out for in the research discussion section. Then observe author's critique of the study. More like their limitation. Then note areas of further study. Most times authors do this. They write areas of further study so that you can, these areas of further study can also be a research gap for you also read first for comprehension before jotting down. Then the review is written in a third person pronoun. They say, the authors say, the literature review is written in past tense. They, he, third person pronoun. And literature review most times is written in past tense because it has already been done. That's when you are writing your own. It is written in past tense. Now, the authors say, the authors do, or the authors find or found, not the article, not the title. So it's the authors. You are quoting the authors and not the title of the research. Okay, so this brings us to the end of the discussion section, where I have a demo on how to leverage artificial intelligence in literature review. So I'll do that now before we take questions. All right. So I will send you a list of other artificial intelligence softwares that you can use. However, I'll be displaying one for you to see on how you can leverage it to make your literature review easier. So this one is ScienceSpace. The science is, the short form, SciSpace. SciSpace AI. So you see it here, discover, create, and publish your research paper. So you just click on this site. Are we seeing it, please?
Yes, ma'am. I can see it from my end.
Okay. Okay, good. So it brings you to this interface. So when you get to this interface, you just click on continue. So you now this is the home page of ScienceSpace AI. I'll just go in here and type in my research topic. You can ask question. It could be your research question or just something, anything. Just I'll be typing in my research topic. So I already have it here. I'll just select it. It will open. So it's giving me answers from the top 5 papers in this area. So if you look at it, it will just summarize. I summarized the top 5 areas here for me. However, if you scroll down, you will see for each paper, it gave me insights I can get from each paper. Now, for this first paper, the detection of oral squamous cell carcinoma using pre-trained deep learning models. So it gave me insights. This study evaluates transfer learning methodology using pre-trained deep learning models and all that. So I have so many studies here. I have about 10 studies here related to my topic. Now, if I want to find out something about the methodology, if you look at this, look at your right-hand corner, you will see conclusion. If I want to get something from the conclusion section of these articles, I'll just click on conclusion. Then let's go to method use. I'll click on method use. So if you look at this, you will see for this first topic, let me close this insight. For this first topic, this first article, I have transfer learning with pre-trained models for feature extraction. So this is the method they've used for this particular one. For this second research, predictive modeling, they've used a logistic regression to do as their method, and they also employed machine learning techniques for diagnosis of cancer. So this is the method section. It gives you insight for the method section. If I want something for the results section, I'll just come here and click on results. If I click on results, from all these topics, it tells me, hello? From this results section, it tells me what they've achieved. Now, highest model accuracy was 0.90, that's 90%. Sensitivity is 0.997, that's 97%. So I can see the results of other people's work here. Now, that's how science-based work. And the interesting thing about this science-based AI is that you can also upload a PDF. If you want to upload a PDF, you just go to this top right-hand corner and click on chat with PDF. So it opens something for you to select a PDF. I'll just select this one. It will load the PDF. You select a folder and it just opens it up. So these are tools of machine learning, artificial intelligence tools that you can leverage to make your work easier. Do you understand? To make your research, your literature review research easier, because it's specific, it brings it out for you, it gives you, saves you the time of reading all through and all that. So this is the PDF loading, and somewhere here you're just asking me, ask any question about this paper. So I'll just put in any question I have and to answer me. Do you understand, please?